Okay. You haven't told me anything about what you want.
Okay.
Bye.
Hi, everyone. Welcome. We are super excited to have you with us. Bonnie Brown is here, and she is going to talk about surviving healthcare, which is not, it's not a topic that sounds really exciting, but it is super important. So I am going to hand it over to Bonnie so she can introduce herself. I am so excited that you're going to get time with her to answer your questions and really understand how important this is. And I would absolutely say that it's life and death, and it can determine whether or not you're in a good position and getting the best care possible and understanding all your options, or the opposite, which none of us want. So I am going to hand it over to Bonnie. You are in a live stream chat, so whether you're on Facebook or you're on YouTube, if you can't hear anything or if something's wonky because technology just doesn't want to cooperate, which happens every day, then please type it in the chat because we don't know unless you tell us. As questions come up, also please type that in the chat and Bonnie will stop periodically and answer your questions. Thank you so much. Bonnie?
Hello, everybody, and thank you for joining me for this first ever Surviving Healthcare webinar. Okay, so today we're going to talk about how to use the power of advocacy in order to make your aging easier and far more affordable. So I'm not sure if you had caught what's been going on with this Medicare insurance training series this week. It's been wonderful and so informative. The first 4 days were all about your Medicare insurance, what it is, how it works, what you need, pitfalls to avoid, and that's all great. So now that you know how to get your insurance, the next question becomes, now what do I do with it? So that's what I'm going to focus on today. Whether you have Medicare insurance or any other kind of insurance, we're going to talk about how you can use it to take the hassles out of healthcare. So I'm Bonnie Brown, founder of A Better Life, and I'm a board-certified patient advocate. I'm also a certified Medicaid planner and the winner of the AARP Caregiver Accelerator program. Today, we are going to talk about what self-advocacy is, and we're going to talk about how you can use it to get to your best wellness possible. And also, I'm going to cover the 5 simple steps for taking the hassles out of healthcare. This is something that I had to learn, unfortunately, the hard way. And I did that by having a whole lot of medical issues, and then I began helping somebody else with it, and one thing led to another, and before I know it, I was helping all kinds of people, and then people began knocking on my door. I didn't know that it had a term for it called self-advocacy, but that's exactly what it was, and it's becoming more and more prominent. Sometimes you hear an advocate called by a patient navigator, nurse navigator, healthcare advocate, patient advocate. It's got a lot of different terms, and it also just stands for you standing up for yourself and representing your own points of views or your interests. So, as I said, I had to learn this the hard way, unfortunately. I've had a lot of medical challenges in my life, and that's led me to 17 different operations, 10 in the last 12 years alone, and I still have 4 more to go. So I learned it from the inside out. Sometimes I tell people that I became the accidental advocate because I just had to sink or swim. And it was one of those things, you get thrown into the deep end and you have to figure it out. Unfortunately, I did a lot of things wrong. But I have a secret weapon, actually 2 secret weapons. I had a brother who is a physician's assistant and a sister who's a medical lab technician, and together they helped me learn the power of advocacy. So I had somebody to go to, and I got better as time went along. So much better that I saved $150,000 in my first year alone when I started using the system I'm going to teach you today. I've also had $350,000 spent in out-of-pocket costs and have managed more than $2 million of my own hospital claims. So I know a thing or two about how the system works, and I'm going to try to simplify it for you. And if you stay to the end, one of the things that was promised for being on today's webinar was a free doctor visit guide. This is how it all started for me, frankly. I was trying to find an easier way to simplify my doctor visits. And the thing that came to me was the advocating approach framework. That's here on the left, and it's included in this guidebook. And it really is a roadmap or a cheat sheet for how to talk to your doctor. And on the right, there's a doctor visit checklist of what to do before, during, and after your doctor visits. I found when I started to put this into a system, it made my life a whole lot easier, and I got a lot more out of my doctor visits. And not only that, but it helped me to improve the relationship I was having with my doctor. So I'm just like you. Right now, today, I am frustrated by my healthcare. I am overwhelmed by the complexity. Although I know a lot, I still have a lot to learn. I'm challenged finding decent doctors, and I am sick and tired of paying way too much. So what's the problem? Why is this so hard for us? Well, today's biggest problem is we're in the midst of a pandemic, something the likes of which we have never seen before, and people really need to know how to better advocate for themselves. It's really important that we start to get this right because it's going to matter. And why is that? Well, healthcare is dangerous. I've come to see that firsthand. I woke up from my first surgery to be told, "I'm sorry, but you're not okay." But I woke up from my last surgery to be told what you did saved your life. And I know it. And I would like to show you how to simplify the process and be aware. And I think most importantly, I want to teach you about the mind shift you need to make. Because if you're anything like me and you're healthy, you start off healthy, you think to yourself, I'm good. I'll deal with this when the time comes. And you think you don't need to know how to advocate for yourself because you're well. The truth of the matter is, those that are already well probably need it the most, because those that are already in the system, they already know that they need this because they're struggling. So we're moving into a do-it-yourself type of healthcare. I don't know if you've been to CVS lately, but the line for the testing line for COVID is way longer for the line to pick up prescriptions. And those folks are going to have to do their own COVID testing. They're going to have to swab their own nose when they get there. And I think that's just crazy. So too many people have died. Millions more are suffering from the challenges that the coronavirus brings. And the question is, are you going to be ready? Will you know where to go and what to do and how to do it the moment you get sick? Will you know how to get yourself to exceptional medical care? Will you know what to say and what to ask your doctor? Because there won't be time to hesitate. You really are going to need to act and act fast, which is why you need to learn how to advocate for yourself. I believe that the success of your outcomes will depend on the decisions that you make or don't make, and it really could be a matter of life versus death. So I don't know if you saw the AARP bulletin that came out, but it said, "Stay healthy this winter. A 5-part plan to lower the risk of the flu, coronavirus, and a common cold." Well, I'm going to teach you a 5-part plan, but mine has to do with becoming proactive versus reactive. I'm all about getting ourselves ready before we get sick, because I know that the most important thing is to answer the question, what can I do to remain safe? Look, coronavirus is changing everything for us. Like, we're not going to go back. It's kind of like the September 11th tragedy. There is a definitive before and after period, and we're going to have that when we look back someday and say, do you remember the day when we could walk around freely and not have to worry about masks? So I really believe that the single most important question you can ask yourself right now is, what can you do in order to remain safe? So here's the bottom line. Most people don't even realize that before you can gain confidence, capability, and control while navigating through healthcare, you first must understand that it is your responsibility to advocate for yourself and those you love. Yeah, it sounds so simple and practical, but it's oh so complicated, right? Maybe you can relate. When I got sick this winter, I didn't know if I had the coronavirus. I was scared and confused, and the testing was still unavailable. Resources were hard to come by, and nobody seemed to have the right information on where I needed to go to get that test and how this was all going to work. So the need for advocacy became a matter of life or death very quickly. And we had to stand up and fight for ourselves to get that good and decent health care. The decisions we made or didn't made and the order we made them led us, my husband and I, to having two completely different outcomes. I was able to get myself to the coronavirus testing site behind the hospital on the day that it opened. I was probably one of the first 10 people that they tested. But my husband was never allowed to be tested at all. And that's the difference. What he said and how he said it and what he did, it didn't work. So I got phone calls and ongoing communication, but he got nothing but lies, runarounds, and misinformation. We were both sick for 12 weeks straight. And what did we learn? We learned that our doctors are not in charge of healthcare. We are. So why not? Why aren't people doing this? Well, reason number one is you're probably overwhelmed. There's a lot of information coming at us every single day, and it's all contradicted. We don't, at this point, know who to believe, and we don't know who to trust. We don't know which hospitals we need to go to or what medications or if there'll even be enough respirators to keep us alive. There is a lot of fear and frustration going on. Sure, social distancing and stay-at-home orders all sound good, but then what? What if you still get it? What do you do then? And that's where it comes to advocacy. You've got to be ready for the what ifs of life. And you may not be doing self-advocacy if you're confused because you really don't know how to get your medical affairs in orders, co-pays, deductibles, out-of-pocket costs. It's like learning another language, and there's so much that you need to know. Even me, as much as I know, I was told that my COVID test was going to be free. And then I got a bill in the mail. They billed my insurance $1,200 and balance billed me $200. How's that free? It's ridiculous. So you're going to have to fight for yourself, and you're going to have to know when you can stand up and get these situations resolved and when you can't. So it's not easy. I know healthcare comes with hassles. And it's not a matter of if you're ever going to need it, but rather when. So that's why I'm going to teach you this simple 5-step system to help you know how to navigate your way through it. A lot of people I know are frustrated by healthcare, and they're at higher risk because of their age or physical condition. So it's not just about hygiene at that point. It's about you knowing how to maneuver and have an emergency preparedness plan in place. I tell anyone who's got high risk, you of all people need to be prepared. I've got a go bag packed. I've got my medical affairs in order. I've got my medical organizer up to date. So you might not make it easy, but you can make it easier. And that part is a real big part of it, because I learned that there comes a peace of mind when you know that you have thought through this and you have prepared in advance. If it happens, you don't panic and you don't have as hard of a time getting through the process as if you didn't prepare. So the question becomes, can you imagine what it would feel like if you didn't have to worry about having medical events or medical emergencies? I'm here to tell you that it is possible. What I learned was that you need two things if you want to survive healthcare. You need good communication and excellent organization. And those two things are easier to do than you could probably ever imagine. What you need is a roadmap to follow. Something as simple as 1, 2, 3. Do this first, do this second, and do this third. So it also comes down to what questions you should ask your doctor before you get sick. So right now, if you're healthy, perfect. Now's the time to start asking. If I woke up sick tomorrow, what would you want me to do? My doctor originally wouldn't see any patients and said, go to the hospital, because at that point, you couldn't even go to a walk-in clinic. Now some walk-in clinics can accept you, or you can do those drive-through testing. So it really depends on what your doctor wants to do, and that may be changing. And also, like, would you be able to see me in person, or would it be a telehealth visit? Well, telehealth visits are great, except for they can't actually test you through a telehealth visit. So that may be the first line of defense. And would you need a specific referral in order to go get that test? I did. I had to get that first before I could go. And I find out if they're doing strictly telehealth visits and if there's anything you can do, or when and if they can see you in person. What happens when telehealth isn't enough and you are sick and need to go further? Then what? What if you get sick on a weekend or a holiday? You need to be thinking about that. Same goes with if you're having trouble breathing. At what point do you know that it's serious enough to actually go to a hospital? And when it comes to your patient care, you want to know from your doctor, what are they going to do differently? And are there different stages that are permanent? Like, is this something the doctor's doing just now, or are they changing the rules forever? Some are. And what can I do to help you help me? I asked my doctor this question, and she told me that I could purchase a kit that has different devices I can use so that she could do a better exam on me. What medical equipment should I have on hand for telehealth visits? Same thing. I got a thermometer, I got a pulse oximeter, and some other things that my doctor recommended. And how can I avoid making big mistakes? I actually got some recommendations on my doctor for this, and we talked about communicating through the patient portal. It took some time for me to learn how to do that, but I did a couple of test emails back and forth to her, and we were able to connect. And then how can I better advocate for myself to get to better health outcomes? And you just put it right out there and say, I'm worried about this. And finally, how do we move forward from here? So these are the types of things that you can be asking now. And even if you don't do it to your doctor, call the nurse's hotline or even just call the appointment line and say, hey, I've got some coronavirus questions. Can you help me with them? Now, the opposite happens. When you get sick, you're going to find yourself entering into a system where they're going to begin to ask you the questions. And you need to be aware that depending upon what you answer may or may not open the gateway for you to be allowed to be tested. So, for example, they do ask if you have cough or shortness of breath, or if you are sick actively. If you have a fever, for example. They asked me in the past 14 days, did I travel internationally or to specific states? They asked me if I've had any contact with anyone else sick. Have I been tested for COVID-19 or treated for COVID-19? If yes, it was a positive result. If no, is it still pending? So depending upon how we answered these questions, determine whether or not we're able to get the test. Now, I really hope going forward that we're not going to have so many hurdles. If you want a test, you can get a test. And I do believe that places like Walgreens and CVS will allow you to go and pay cash for that. Last I checked, it was about $120. So you really need to call the insurance company and find out if COVID-19 testing is available and if there's any hurdles to get it. Okay, so we're up to myths. This is one of the biggest problems that I had. I went into my healthcare having these myths, and I didn't know that they were false. I had to learn all of this the hard way. And the first one is the doctor is not in charge. I used to think that all I had to do was show up at the doctor's office, be nice, pay my bill, and it was their job to fix me. I honestly had that point of view, but I don't have that anymore. I know that I must be in charge and I must take responsibility for my health. I've also come to see things from the other side of the fence. You know, I didn't always have my doctor's point of view, but now that I see that they're seeing, 50 to 100 patients at a time, they're just cycling through people every 15 minutes. And in a week's time, they just have seen so many different people, and they're not going to be able to remember everyone and everything. So you've got to really make some noise to get in front of them and have them know who you are and what your needs are. And you have to keep making sure they're delivering what they promised to you. So that old Marcus Welby show, I know I'm dating myself a little bit here. Back in the 1970s, we had a show, Marcus Welby, MD, and you had one doctor that did it all. And this was true. When I grew up, I had a doctor named Dr. Salazar, and he took care of us from infancy to death. There were 7 kids in my family, so he took care of all of us, and he could do everything. And of course, on these TV shows, everything always worked out so well. Well, it doesn't go that way any longer. Now we practically have a different doctor for every body part. And not only that, but we also have it that these doctors have different levels. So I thought a knee doctor was a knee doctor was a knee doctor. Turns out there's different kinds of knee doctors. And there's knee doctors that help when your first knee doctor didn't get it right. So it gets a little crazy. We also have some wonderful technology, but that doesn't necessarily make it any easier. In fact, it makes it extremely difficult and more expensive. And it also means that we need doctors specifically that can do just one thing. And because of this, doctors don't know everything. You know, they are human too, and they only know what they've been trained to do or what they've learned on their own. So they've become highly specialized, and often they have to reach out to their colleagues in order to help us. So in the end, that means that ultimately nobody is coordinating our overall care. We're kind of left to fend for ourselves. And by the way, I will get with Bethany to make sure you guys can all get the slides to today's webinar, because I know there's a lot of information here and I want to make sure that you can have access to this afterwards. So we'll work that out, okay? Okay, so here we go. What is the solution? I've come up with a 5-step plan for surviving healthcare. This is tried and true. I have been using this for the past 20 years. This has saved my life and changed the lives of many others. It looks really simple because it is. So we're just going to go through it one by one by one. Let's use the mentality today that you woke up with the coronavirus, or you suspect you woke up with the coronavirus. What would you do? Now, of course, you're going to have all these things running through your head. You're going to start thinking, oh my gosh, okay, I'm sick. Where do I go for the testing? Where am I gonna get help for it if I do have it and it's positive? Will my doctor see me? What's it going to cost? What pharmacies can I go to? If I need to go to the hospital, what hospital? You know, all these things are going to come at you. If you have children, you're going to be like, oh no, how am I going to take care of the kids? And how am I going to drive them if they're going to school? If they're not going to school and you're homeschooling, you're going to be like, oh no, how am I going to homeschool my kids? And I'm going to need to quarantine. How do I make that happen? And who's going to make dinner? You know, all these things start to rattle around in your head. So I tell everybody, doesn't matter what your problem is, coronavirus or something else, if you wake up and you're not okay and you're finding that life is feeling like it's getting out of balance and things are spinning out of control, the absolute #1 place to begin is to simply get it out of your head and get it written down onto a piece of paper. Personally, I like to do this at night when I'm trying to clear my head for the day and figure out what tomorrow brings, but it doesn't matter when you do it, it just matters that you do it. So the reason that you do this, besides getting it out of your head, is you want to start coming up with an action plan. What are you going to do and how are you going to do it? So step 2 to that is take all of that stuff. You might have 20, 30, 40, 50 things on your list. You can't possibly do them all, or at least all of them right away. And all that's going to do is bring you to a screeching halt, because it's just too much to bear, especially when you're sick. You have enough time getting through the day, let alone dealing with all the things you know that really need to be dealt with. So I tell everybody, focus on your top 10 things to do. Break them into a priority list and start trying to group them together. So let's say, for example, you need to call the doctor. Find all the things that are related to the doctor that you need to discuss and put them onto one little thing. And however you can, try to combine like items to make it more palatable. Same goes with the insurance company. If you need to call an insurance company, just put together everything that you have that you know you need to discuss. What are your deductibles? Where are you in terms of your annual out-of-pocket costs? What's the most it could possibly cost you? Is this covered? Is this not covered? Ask them what kind of things you need to be aware of or talk to the doctor about. I often cross-reference, and I often use my pharmacy. They are wonderful, wonderful fountain of information. So I will go to them and I will ask them, what should I ask my doctor? What should I ask my insurance company? And I've learned a lot from them. They've been very, very helpful. Okay, so after that, all right, you've taken all the things that are bothering you and you've whittled them down into a top 10 list. Now what? What do you do? Well, the next step is to do a daily things to do list. And that gets you focused. I break mine down into phone calls, things to do, and things to buy. I don't know. I've just done this for years and years, and it works for me. So do whatever works for you. But I try to work on my things to do list early on in the day when I have the most energy. And I know that doctors' calls, for example, or insurance calls, you could be on hold for 20, 30 minutes easily. So I'll have other things to do in the background, filing things, checking things, sorting things. And while I'm on hold waiting for that phone call, I try to, make the best use of my time, but it doesn't take very long when you're sick or injured to run out of steam and have to take a break. And sometimes this is so overwhelming, you need to literally walk away. You just need to put it down for a couple of days if you can. But when you've got COVID-19 or something more serious, sometimes you don't have the choice. You really need to power through it. Or it helps for you to divvy things up to give to friends or family members that are offering to help. That was probably the hardest thing that I ever had to learn. I don't like asking for help and I don't like accepting help, but there comes some times in your life that you need to do it. And I know that I've always been there for my friends and family members, and I'm happy to give. So I know others are happy to give. I just have to learn how to be happy to receive. And so this things to do list, believe it or not, is something so simple, but it's what got me to be willing to give others some tasks and say, okay, this is what would be beneficial to me. Okay, so next up is to create a medical organizing system. I can hear you groaning right now. I know everybody hates this, right? It's what's going to keep you alive. So you've got to find a way that it's going to work for you, because there is nothing, absolutely nothing more important than having your medical information accurate and up to date. And believe me, this is a challenge because all of the healthcare systems don't talk to each other. You will have one doctor on one type of system and another doctor on another, one hospital on one and one other hospital on another. And that makes it extremely difficult because they put information in, but nobody takes information out. So if you have one medication and you go up with a dosage, they just say, okay, she was taking 10 milligrams of this, now we're going to 15. They never take this 10 milligrams away. It stays there. So when somebody else comes in and looks at it in their organization, or if you do get a copy of your records, you're like, what? What's up with this? It's not even, I'm not taking that anymore. I'm taking the higher dose. It's easy to get it messed up. And this is where people get hurt. And they get hurt badly because mistakes are being made. I've even had a client of mine who was given a form of pain medicine in 3 different names, and nobody that was managing her care knew that the others were giving it, and it nearly killed her. And so if she didn't have a good friend that got in her car and drove a half an hour to check on her because she knew something was wrong, and she found her nearly dead. So it happens. You don't think it's going to happen, but it happens. So this is where you've got to go to keep your medical information right. It's what's going to save your life. So what kind of information? the basics. You know, when you get to the doctor's office, right, we all have to fill out that clipboard. That's where you start. The information that's on there is the most important information. So your medications and your supplements, your vitamins, your doctors, the pharmacies you go to, the problems you're having, your health insurance. Even if you just jotted this down onto a piece of paper and took a picture of it with your cell phone, it could change your life, especially in an emergency. And I've been there. I've had a heart attack caused from a stent that had gone wrong. Had a stent put in, I had a blood clot, and I didn't know what was wrong, but instantly I knew something. Just wasn't right. We called 911, and within 2 minutes, my blood pressure had gone down 46/20. I was nearly gone. And I could feel myself sliding away, but I still had the information nearby. So I said to my husband, get my medical organizer. And he had everything. So when they're asking the questions, boom, 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 he could answer it. If not, I had it in my phone. I could point to it in my phone and say, here it is. So have that available. That could make all the difference in the world. So everybody's got to find something that works for them. I don't know. To me, this is a tried and true thing. I like breaking it down into sections to make it easier to find. So find whatever works for you and then stick with it. But I like all of the stuff I need for my doctor up front. We'll get to the medical summary report in a second, but I put all of those together. I put my insurance together, my billing, my labs. You know, when I'm going through a health episode, I might have something on my knee, or if I had something going on with my back, like whatever was going on, I kept that together as well. So it could be by doctor or it could be by subject matter. It really doesn't matter. The whole thing is, when you're in front of the doctor, you've got 10 seconds flat to be able to answer their question. And if you don't answer it, chances are they're going to delay you, or they're going to run a test that's going to run up the bill. So the best thing that you can do is just have the information readily available and know where it is so that you can answer the questions. Okay, so I just was talking about the medical summary report. If you did nothing else, this could change your life. One thing, nothing else. Do this every time you go to the doctor, even if you fill it out when you're sitting in a waiting area, because this gives the doctor everything they need to make the most of that doctor visit. So you walk in with an overview and you're just saying, this is why I'm here, doc. This is what I need from you. Here's the bottom line. Don't worry about the 20 things that are going wrong with you. What's the one thing you need that doctor to focus on? I am here to get to an evidence-based diagnosis. I'm not okay. I don't know what's wrong. Here's the history of medical problems. Boom, 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 boom. I did this, I did this, I did this. You know, my top concerns, I'm really freaking out. I'm really worried that I'm not going to be able to do this, this, and this, or that it's this, this, or that. And finally, the questions that you have. Now, a little tip for you. I provide this to the medical assistant when I get to the doctor's office, and I say to them, hey, psst, can you have the doctor look at this before he walks in or she walks in? And they always do. And so one, that stretches out my doctor appointment. I'm not giving up my valuable time of my 7.9 minutes that I meet with the doctor. And I have found that they've either gone off to get something else, or they often will say to the medical assistant, can you bring me a copy of this or that, something related to it? Or they'll walk in and say, I wish every patient had one of these. I've just gotten such great compliments from this, and it really has made things better. And then each time I go to the doctor, I'll look back on this and I'll say, oh, wow, this was really awesome. So I think this is really helpful. And here's a sample. You just fill it out, explain what's been happening with your health, explain the history of your medical issues, your concerns, and a list of questions. So that's it, my 5-step plan. Problems and pet peeves list, top 10 priorities, things to do list, then work on your medical organizing system, and always have a medical summary report. So I know a lot of people get really freaked out and they're like, oh my gosh, okay, yeah, I agree with you. I know that I need to do this, but I'm not gonna. I'm just not. It's too much, and I need somebody else to help me. So if you would like my help, I have educational training and coaching programs that will help you do this. We have coaching, We can help you be accountable and help you get through the process. But it really is easier than you could ever possibly imagine. You just have to start with the basics. And it's one of those things, once you do one thing and you have that done, it's like you put it into your file and, okay, what's the next thing? What's the next thing? It's just a matter of getting a system in place, and it becomes automatic, like riding a bike. You won't even realize that you're doing it. I also have another webinar masterclass coming up just like this, that I go a little bit further into this. So you're more than welcome to join me. You can sign up on my website, which is www.abetterlife.me. And the link for sign up is right there available on the front page. And also, for coming to today's webinar, I'm offering you the doctor visit guide, and that is also available right now if you want to go get that today. And here is the link that you can go get that: https://abetterlife.me/wp-content-abl, which stands for A Better Life, /doctor-visit-guide.pdf. That's a mouthful. Bethany will also get you the link to this, but if you wanted to do it, you can even take a picture of this with your cell phone. And so I'll come back to this in a second. I just want to say thank you. Thank you for the privilege of your time and for being here today. I hope you got something out of this, and I hope, if nothing else, that you recognize the need for self-advocacy. I know that it's common sense, but common sense isn't always common practice. Oh, hello. I don't hear Bethany.
Sorry, we have a couple questions if you don't mind.
I'd be happy to answer any questions you have.
Okay, what do you think is the biggest challenge? What do you think the biggest challenge is going to be with the coronavirus?
Fear. I think if anybody sneezes, the world is going to turn around and freak out. And we're coming into cold and flu season, and there's a lot of unknowns, and everything is changing, and that information is not being communicated to us. And so I think the next probably 6 months are going to be a real big challenge in that regard.
Okay, and what are your thoughts on a vaccine?
Okay, that's a good question. I'm all for a vaccine. I'm all for it as long as it's been proven to be effective. And I'm one to dig into the science. So when it comes on the market, I'm going to be watching, and I'm going to be digging into the statistics. For those that are more at risk, it's something, especially me. I have chronic conditions. I need that. I need it badly. But I also want to make sure I'm doing it smart. So I'm following the information, and I'm tuning into, and there's a lot of information out there. So I know it's hard to know who to trust, but I'm following the doctors, I'm following the scientists, and it couldn't come soon enough, to be honest with you.
Okay, hold on, let me see what else. How do I find a better doctor?
So I find that one of the things I did in making a mistake in choosing doctors is I first chose a doctor because they were close to my house. And then I chose a doctor because they spoke perfect English. And then I chose a doctor because they validated my parking. Don't ever do that. Don't ever do that. So I do my homework. I absolutely get into it. I don't know if you've ever seen the book, The Patient's Playbook, Mickelson. Well, The Patient's Playbook. It's a wonderful book, but in it, it teaches you that, how do you find a good doctor? You get into the websites. First of all, I start with, what does my insurance cover? And then I go look, and I want to know what hospitals they're affiliated with. Do they do any research projects? Are they published authors? And I try to find the ones that are the most skilled in the industry. I also shamelessly ask nurses, hey, who's your doctor for this? Who's your doctor for that? Sometimes doctors refer you to doctors in their network. I don't, sometimes can be a big mistake. I don't want a doctor in a network that's just a buddy of theirs. I want the top of the food chain, the guy that fixes the other guy's problems. And so I often will look for somebody related to a level 1 trauma center, or somebody that's been a published author or has gotten peer reviews or something like that. But I never, ever, ever choose a doctor based on where they're located any longer.
And I think you had told me when my mother-in-law was in the hospital and they wanted to send her to a short-term care facility, and you said the doctor can't make a recommendation, but ask if this were your mother, where would you send her?
Mm-hmm.
So it's not really like a recommendation if it's their personal, they know where they would send their mom and where they wouldn't.
Well, yeah, it's interesting because you can't say who's the best. So you could say, who are the top 3? And then you can say, if it were you in this position or your mother, which one would you pick? They can answer you then, but so it's a little tricky about how you ask. Does that make sense? And yes, of course, I do start with friends, but I can ask my friends, who's their doctor, who they like, and they'll tell me. My very next question is, why? Why do you like them? Oh, he's such a nice man, and he went to, University of Florida, or he went to this Cornell. Well, it doesn't matter to me what school they went to. I want to know that they're a good doctor because they'll see you after hours, or they'll give you a phone call on a weekend, or they'll go above and beyond, or they have that sixth sense and they've been able to help you, or they'll reach out to a colleague when you're not okay, or they'll call in the hospital if you need to go to the hospital, and they'll have a team ready, standing by, ready to meet you. It's what they do for you and how the level of care they provide that I most care about. And most people don't even think to ask that.
Okay. So somebody asked, my doctor wants me to have a telehealth visit, but I don't feel like that's a real visit. So do you have any tips on how I can make that work better?
Work better. Okay. I am not a fan of telehealth visits for somebody with chronic illness. I'm just going to put that out there. I have had them successfully for me, and they're okay for a follow-up visit or a first line of defense. Like, okay, is this bad enough for me to go to the hospital? One of the very first conversations I had with my doctor is, what can I do right now to be a better patient and have you be a better doctor over a telehealth visit? And that's where I was told that it would be helpful to have some of the equipment. And I'm currently doing research on purchasing a medical kit that will allow them to look in my ears and in my eyes and down my throat. There's actually something on the market. You have to ask your doctor which ones they use, because apparently it attaches to some sort of software, and then they can interpret the results and all that. There are so many different smart devices out there. So for me, it's worth having that. But in terms of the general person doing it, one is try to get their staff to practice with you to get you through the portal. It's very stressful at the last minute to try to be doing that. And then by then you get so few minutes that your head isn't in the game. So you need to show up to that prepared. And I do a medical summary report days in advance or hours in advance, and I send it. And I always ask the doctor to review it before they come on. And that's been a big help as well.
Okay. So do you know if my insurance will cover the coronavirus testing or the antibody testing?
Most all insurance these days does, but I put the caveat on most. Some of them, it just depends on where you are. Like, remember I showed you earlier that you need to have an active fever or you need to have known somebody. If you're over 65, you'll have an easier time getting approved and getting it. But if you're under 65, you are going to have to fight for it. And you are going to have to show need. I know it sounds ridiculous, but seriously, my husband was very, very, very sick, and he could not even get the test because he was probably at that point 2 weeks or 3 weeks into the illness, and he didn't have the high fever that he had for the first week or so. And they just said no. I mean, he was traveling through the international airport at Pittsburgh International, but they said, "Were you traveling internationally?" And he said no. When they asked me that question, "Were you traveling?" I said no, but my husband went through Pittsburgh International Airport. See the difference? I mentioned the word international airport and that he had been near somebody who was Asian and who had been sick, and he was very worried about getting it. So we suspect that that's where it came from. He just happened to be near a guy that was sick for a very long time because they sat in pre-boarding together and on the plane near each other. So, it's one of these things that best to know before you go. Now, for me, I did call my insurance company and I said, "Is this going to be covered?" And she said, "Yes, it's going to be free, but you're going to need a prescription from the doctor." So then I go to the doctor and I said to the doctor, "Is this going to be covered?" And she said, "Yes, but you need a prescription for me." And be sure to tell them when you get there that this is not to be billed through the hospital. And so what did they do? They billed it through the hospital as a hospital test, and they billed my insurance $1,200. Well, some people are like, I've already hit my deductible. I don't care. Here's the thing I'd like to say. You need to care. Like, I can't tell you how many of my clients just don't want to go through the pain and hassle of getting a medical charge fixed. 80% of your medical bills have errors on them. And the thing is, if you don't go after that and you don't get them to get changed, we are all going to pay higher premiums next year for that waste. There are just billions of dollars wasted every year on duplicate charges and downright mistakes. And I know it's a pain in the neck, but you kind of have to be looking out for the bottom line of your own insurance company and be good stewards of your insurance, because in the end, it really does matter. Our rates are based on what was used last year. So if all of us can work to drive down the cost of healthcare, then all of us will benefit from lower costs of healthcare.
Right.
Does that make sense?
Right.
Yeah, it really matters. You need to do that. So this $1,200, you bet I'm going to go fight that, and I'll get it fixed and I'll get it turned around. But it's going to come with a little bit of a hassle. So I'm going to do it early in the morning, and then I'm going to celebrate my good deed when I get done.
I know my mother-in-law, when she got out of the hospital, of course, she get all these bills. Some are from hospital people, some are from contracted people, and she was charged for 3 walkers and didn't get a single walker from the hospital. So she didn't know if she was being charged to use the walker in the hospital. And when she had called, they said, "No, you took a walker home with you." And she's like, "I didn't take any walkers home, and I'm being billed for 3.
Yeah.
And they just, I don't understand.
It's so sad, but true. Here's another thing that I do. I do not pay a medical bill unless I have an explanation of benefit that marries up against it. So I keep plastic folders, and everything goes in there, the explanations of benefits and the medical bills. And when I have an exact match, I pay and I go. Sometimes if I don't even know it's an exact match, what I'll do is I will call the insurance company and I'll say, "Hey, I've got 2 sheets of paper in front of me. Can you help me make sure that this is accurate?" And they're happy to do that. So that's another thing if you really don't know. And then often we'll get billed things that are like, what? It's 6 months later and you're looking at this like, what are you charging me for? I don't even understand this. So everything gets billed under a CPT code, and I'll just go type in CPT and then the numbers I see that are like Greek to me on this sheet of paper, and then it'll come up. And a couple times I'm like, that doesn't make sense. I didn't have that. Or other times I'm like, how are you pricing this separately? You're charging me over here for this and you're charging me over here. I'll call the insurance company, and often it's double billing. It's just not billed correctly. And I've had bills that have come in a year later, and there is a cutoff at a year. If they haven't billed you up to a year, you do not have an obligation as a patient to pay that. So I've gone back and fought that as well. So I truly have saved in that first year alone $100,000 to $150,000 by doing this with these surgeries that I have. So there are, and I've had a lot of people say, well, there's no way I'm going to be able to do this. There are people that are medical billing advocates. That's what they do, literally. And they do not charge you. It's kind of like a lawyer that only takes a percentage on the back end if they save you or they get you money. It's the same thing. They take a percentage, and it's, they won't take you on a case if they think your bills are accurate. So you have nothing to lose, because otherwise you're going to be paying that. So if you have a lot of hospital costs, it's worth saying. And I am really, really concerned about the people out there that are losing their insurance right now. And, their jobs have gone away, and maybe their insurance has gotten to, a temporary policy or something. But it's going to be really scary, because people roll the dice and they say, oh, I'm healthy. The problem that I see with that is in the past, I got caught in that loophole of a pre-existing condition. I tried to find better insurance, and when I switched over to find the better insurance, it took them 6 weeks to say no. But meanwhile, I thought they said yes, because I sent my check in and I thought everything was fine. By the time they came back and said, no, we're not going to accept you because you have pre-existing conditions, I couldn't get to another insurance plan because open enrollment was closed. And I went a whole year with no insurance. And then I found myself not wanting to get medical care because I had no insurance. So it's a vicious cycle. It's really difficult out there, and you've got to find the plans that work for you, and you've got to fight tooth and nail to keep the coverage you have and to make sure the coverage you choose is the right coverage. I also have a lot of people that say, well, I'm healthy, I'm not on any medications. Why do I need medication coverage? Because it only takes one medication to be worth it for the whole year. I've had heart medications that were $250 a month, and they're telling me you need this to survive. And then it goes to a generic drug 6 months later, and suddenly it's $10. Tell me how that makes sense. It's true. But I've also been able to learn how to go and apply for discounts, which is humbling, because you're like thinking, I can't believe I have to do this. Like, really? Or coupon shopping for medications. But I'm shameless. I'll do it. I'll ask my doctor for freebies. I do it. When your back is up against the wall, there's a lot of things that you never thought you would do that you will end up doing. So you just have to start paying attention and learning your way through it.
Right. So a couple more questions. This seems so overwhelming. If I had to do just one thing to focus on, what should that one thing be?
Okay, so that's a really good question. And that one thing would be a medical summary report. It's a game changer. You will see an absolute change in the relationship with your doctor the minute you start using that. 9 times out of 10, they will stop right then and there and tell you how wonderful it is. Flat out, they will tell you. You've made their job easier, and they so appreciate it. I've even had it when I've gone to the emergency room. Seriously, I was on my way and I just jotted it down and got there. I was having active infection. I had a lot of pain in my knee. I wasn't okay. I had a suspicion of what had happened, but I just wanted to be able to make it really quick and clean and clear. And so, yeah, I think that that's one of the things that is the most helpful. Hello, did I lose you?
I'm sorry. My screen refreshed. I was trying to swipe and it swiped away. Okay, go ahead.
No, that was it. Medical summary report. One thing. Super simple. I mean, literally, you could just take a little notepad. Here's why I'm here. Here's my concerns. Here's my questions. I mean, it could be done on the back of a napkin if you had to.
Another super important question. What are the biggest mistakes you see people make?
I know this. Oh, I got this. I know this. It's okay. It's no big deal. Right? I often will have people that will have a conversation and they'll say, just like getting your medical affairs in order. Yep, I know. Yep, I gotcha. But then something happens to them and they call in a panic and I say, did you get your medical affairs in order? Yeah, no. Why not? Well, I was healthy. I figured, I had time. The time to act is now when you're okay. Today, right now. If you don't have your advance directives done, as a matter of fact, let me see if I can share. Yeah, it's not here. Okay, if you don't have your advance directives done, you need to get them done. So if you don't even know what an advance directive is, you really need to get it done. So on my website, under resources, I have a link to advance directives. They're different for every state, and people make the assumption that they have time to figure it out. But even, especially for caregivers, I was a caregiver for my sister long distance, and she went missing for 5 days. She's special needs, and couldn't find her. And I started calling around all the hospitals, and she was there. And the first question was, do you have her advance directives? Do you have her power of attorney? To which I replied, what's that? And she said, it's something you really need. And it's true. In order for you to have a conversation with the doctor, you're going to need that. So it's important to have those affairs in order.
Okay, I'm posting the link to the advanced directives on your website, so that'll appear soon. Another question, how do I find someone like you to help me?
Well, I'm a board certified patient advocate. There is actually, if you Google board certified patient advocate, I think it's www.pacboard.org, and you can look up for other patient advocates. As I said, they come in different names: patient navigators, healthcare navigators, geriatric care managers. So you might, in our area in the state of Florida, well, every state has an area agency on aging. You can start there and ask if they know of anybody. You can ask your doctor, sometimes they do. But I think the first place I would go to is the Board Certified Patient Advocate website, because it is so hard to get certified. It's like taking the boards for, a doctor says I've got to pass my boards, or a lawyer says I've got to pass the bar. It's not easy. And it puts everybody on the same playing field, and it makes sure that your body of knowledge is the same, or on a playing field that everybody can help others. Anybody can be an advocate. I started out, I didn't have any credentials. I worked into those. Of course, I have a master's degree in human development, so I was always interested in organization and communication. But I didn't have any kind of healthcare background until I became a patient over and over and over again. Then I combined it and went further. I also became a certified Medicaid planner because my grandmother ended up going into a nursing home and didn't get proper elder care advice. And she ended up in a 13-year legal battle that destroyed our family. Mm-hmm. And I wanted to learn, how can I avoid that? So I became certified just so that I could teach and train others and learn how to save myself. And a lot of people say, oh, it's really expensive to do that. And, I don't have money to pay the lawyer. Well, you may say you don't have the money to pay the lawyer, but one way or the other, you're going to pay. And you're probably going to pay more dearly by not having put those affairs in order and protected that money. So it's a challenge. I wish that they made it easier. I think going forward, we're going to find the system is going to change to try to help us make that job easier, but we're not there yet. It's kind of like universal healthcare records. We're not there. You, Bethany, can go into your own doctors and hospitals and extract and pull down your information legally. You own it. It's yours. You can have it. And then you can dissect it and put it all together and give it back to somebody else. But your doctor cannot do that for you. Your hospital cannot do that for you. It's coming, but it's not there yet.
Okay. I know you said it's important not to get sick, but what's the best way to even do that?
So that's where I am now. I have struggled for so long with my health. I have to get to the root cause of my problems, and I have to learn how to build up my immunity. So I'm starting from the ground up, working with my diet, working with my nutrition, working with detox. I'm also moving into the functional doctor realm, which I didn't even know what that meant. So a long time ago, I had a doctor tell me that I needed to look into supplements for my knee. I was having joint pain. So he told me to try naturopathic supplements. So I shook my head, pretending I knew what that meant when I didn't know what that meant. And then I went off looking and I bought everything I could find from every health food store, and it didn't work. And then I went back to him and I sheepishly said, listen, we need to have a conversation about this because I'm $500 into this process now and I have no clue what I'm looking for. And honestly, he said, I don't know what's going to work for you, but you just got to keep trying to find something that will work. So I did. Eventually, I found Purium Health products, and that worked for me. But so I happen to be following Bright Line Eating, and that's helping me to eat healthier. But I'm also following a nutritional expert. Her name is Tanya Schnuppe, and she's teaching me how to detox for disease. So she's working with me with my disease, specifically my heart disease. And then, as I said, I just have a new functional medicine doctor. So knowledge is power. Get out there and learn what you can do and talk to your own doctor about that and start checking in with your healthy friends. What are they doing to stay healthy? You know, I'm surrounded by a community of people that are lifting me up, and they're far better at it than I am, and I'm grateful for them. So stick around the people who could help you get through the process and help you learn, because I believe that prevention is where we need to be. You know, they say an ounce of prevention is worth a pound of cure. That's where the future is going to be. You're going to have to focus on not getting sick. Truly, you know, I call my platform Surviving Healthcare, and the key to surviving healthcare is to not need it.
Mm.
And that is really the crux of the book that I wrote. And when I had my heart attack, I had an amazing doctor who helped save my life. And I was so torn up about it and so ready to give up in this whole space that I'm in now and teaching and training people. And she said, if anybody could take this and use this experience to use it in a productive way to help others, you can. This may just very well be the final chapter of your book. And it is, because that's what I learned. I woke up from that first surgery and I wasn't okay, but I woke up from that final surgery to find out from my doctor that what I did saved my life. And you never want to hear a doctor that's seasoned, I won't say the age, but seasoned professionals doing this for decades say to you, I've never seen anything like this. I've never seen anybody with these high levels that you have survive. And I said, no. And he's like, you should either be on a heart transplant list or dead.
Wow.
I mean, who wants to hear that, right? So that kind of got me to stop and think. And then I realized, like, every decision I made at every stage saved me. And you know what? It was automatic. I didn't even know that I was doing it, because these are the tools that I've used and the resources for 20 years that I just knew. Start at the top. What's going on? What's the most important thing? Number one, call here. It literally happened instinctively that I knew to call 911, tell these people that, tell my husband to get a hold of my doctor, tell the doctor that I need somebody to see me at surgery, just right on down the line. It just all fell into place. So self-advocacy is worth your time and effort.
Well, and I guess I got really frustrated after I had my second child. I was exhausted. Something wasn't right. And every doctor I went to my primary, and he said, well, you're getting older, you had kids, everything's going to be harder. And I was like, okay. So I kind of accepted that. And then I went to literally 9 doctors and said, something is not right.
Right.
I know my body. This is not my body. And every single one, they tested like the same thyroid test, every single one. And they said, well, on this scale, you're normal. And I wasn't. And I was so I waited for a year to see one doctor. And the doctor finally, I had to do this test. It's called the drool test. And it tests your metabolism. And I guess the amount that sorry, too graphic.
No,
and he basically said, you have an antibody that's fighting the thyroid medicine. So taking this 3 times a day really a waste of time. I did that for 8 years. And he finally figured out what was going on. But it wasn't fixed. He fixed the symptom. He didn't fix the cause, because every couple months it would get off. I would be exhausted. I would start to gain weight. I couldn't get enough sleep. And I finally went to a naturopathic doctor, and it was my adrenals. And my adrenals threw off my pituitary gland, my hypothalamus, my thyroid. All of these things were affected by my adrenal glands, not by my thyroid. But no one listened to me. So I was done. I was like, okay, this is the new normal. And it's so frustrating.
And so many people give up, but all I can say is trust your instincts. A lot of people that I helped have had things for decades, but they knew that they weren't okay. And they just like, I don't know how to fix this, but I can't, my quality of life isn't as good. And so just like you, they keep going, they keep going, they keep going. And thank goodness that we have these naturopaths. And that is, as I said, the direction I'm going. I don't know anything about it, but there is a group of medical people that are frustrated with the medical process, and they are going outside the confines of traditional allopathic medicine in order to find what's going to work for you. And they're working at the cellular level, and the things they're doing are amazing. Absolutely amazing. And they are getting to the root cause to cure you so that you don't need the pills. It's like slapping on a Band-Aid. And I just had my conversation with my brand new doctor, and I said to him, I am so frustrated. Why aren't all medical doctors learning this stuff? And he said, there's only so much bandwidth to learn in the time that you have. And they were originally started out where they relied on the drug companies to help do the teaching and training. And then the drug companies got a profit off of their drugs that they're creating. So that it became a vested interest in the process. And that then changed the history of medicine. And so if you follow the money, that's the bottom line. Follow the money, because there is so much of it that's being driven, the decisions being made and the care that you receive based upon who's making how much money from whom. And if you go outside of that, unfortunately, it is expensive. But it's, how many times am I going to pay my $3,500, or some people have $5,000 annual deductibles? How many times am I going to pay that and not get fixed? I'm starting to look at it as an investment in better health, so that I don't need to pay that $3,500, $5,000. At one point, I was at $10,000 a year. I am trying to pay the money up front to get myself better once and for all, so I don't need to pay that ever again. But it's hard. It's a shift in the mentality of how you manage your care. It's not easy. So I give you a lot of credit for continuing on with that, because a lot of people do give up. I had a client that was struggling, and it was so sad, because it turned out to be a combination of things. And that's where we also run into problems, is sometimes it's not just one thing, but they were really, really simple things. And one of them was vocal cord dysfunction, and the poor guy thought he had heart disease. And he was just flat out misdiagnosed. Wow. So that went right up into care at the Cleveland Clinic and some other high-end, higher level medical institutes to try to get him fixed. It turned out to be so simple in the end. So, but the problem is you think, like, you're not telling people, like, oh my gosh, I'm thinking like this is cancer, I'm going to die, or this is something really, really bad, right? You live with that fear. I mean, you're not talking about it because nobody's getting to the bottom line, but there are people out there. Actually, there is a website I saw recently where that you can pay, and doctors it's like a medical detective, and you get the top percentage of doctors that come in to try to solve your problems. I didn't even know that even existed. So you'd be surprised what's out there. Just keep digging.
Yeah, because it was interesting, because my naturopath gave me a book that basically said 100 years ago, we weren't as sick. We would grow our own food. There were earthworms in the soil. The soil was nutrient, and there was nutritional value in our food. So we would get nutrients from our food. Now, and fast forward through World War II, and it switched from the Food and Drug Administration. It was really the Bureau of Chemistry, because we had to produce more food. And chemical companies said, we can help, we can make it grow faster. And that kind of started this cycle of, let's see how fat we can make a chicken really fast.
Right.
And let's try to tweak it just a little bit so we can produce more food, so we can meet all these demands of our growing population or whatever it was. But we were a lot healthier before we had all these drugs.
Yeah, well, we didn't have chemicals going through our bodies. You're right. I'm actually working with somebody now that is developing a program to eat more healthy food, and she's going to be putting something out to grow healthy food. And I can't wait to learn from her and begin getting into that. But yeah, I think you're going to see a lot more of that, where people are starting to tune into the food that they're putting into their bodies. And once they learn, they're going to be horrified, just like I was, absolutely horrified. And then for all the people that I've lost in my life to cancer, I think about what if. You know, what if? Is that where it came from? The glyphosate that they have in their body from the Roundup that's sprayed on the crops? It's just so sad. So sad to think about. They're putting these chemicals onto the crops and they know it's killing us and they're not telling us. Why are they not telling us? It's running up the healthcare costs. The entire cycle, it just doesn't make sense. But Americans are getting smarter, and they're starting to communicate to their friends, their family members, their neighbors. And I really believe that we're stronger together, and that's how we're going to get through this. We're going to make the individual choices at a consumer level so that we put our health first. Right. And when we as a whole nation begin to do that in a way that's affordable for all, I think we're going to see significant shifts in just the way that we take care of, manage our health.
Right, right. I mean, I remember when my kids were born and I had to drive to a store that was way across town to get organic baby food. And it was one brand. It was like this much on the shelf. And then you have rows and rows of like Gerber and all the other nasty food. And I can't even pronounce what was in the baby food. I mean, they're chemicals, like from the time you start.
Yeah. Yeah.
It's
and they wonder why we have so much ADD and autism going on in the world. It's just amazing. So you were mentioning the book that you found. Do you know the name of it? Can you share that with us?
I don't know the name of it, but I can find out, and then I'll make sure to post it in the comments or post it, because this will be living forever on the internet. So it'll be in Facebook and it'll also be on YouTube. So I'll find it. It was a quick read, really interesting. And after that, we decided that we were going to grow our own food, and we went through the process of like, whatever, we had to have the plants in pots before we could put them in the ground. And it took us quite a few weeks to get anything to grow. So we saw there were earthworms in the soil. So we're like, okay, soil's not tainted. We planted everything, which of course turned into a me project, even though it was supposed to be a family project. Kids are gone. They are not interested at all. 2 days, everything was eaten and gone. I was like, no.
I know. Well, that's where we need to be. This gal that I'm following, Patricia Boyle, if you're out there, I need that tower garden really fast, but she's going to be, it's literally grow your own food at home in a tower garden that goes up. It's indoor, outdoor. I'm fascinated by it. I can't wait to learn from her. But yeah, I have a dream of just being able to, do this. I can't kneel because of knee replacements. So I'm going to be able to go and do it just standing up and not needing a bunch of dirt like a farmer. So urban growing is going to be coming at its finest. Anyway.
That's awesome. Okay, so there's one more question. A woman mentioned something about she has her mother. She's going to have to, she doesn't want to put her in a nursing home. Can you help her get her medical affairs and her mother's medical affairs in order? So I guess she's asking, is there a way that she can work with you, or how can she find more information about hiring you?
Well, I have, the educational training and coaching programs. Best thing to do is get on my website and get on my mailing list, and you'll hear about them. And I'm not actively doing Medicaid planning any longer, but I can help to try to find somebody. There is a cmpboard.org, like Certified Medicaid Planner, cmpboard.org. And that will help you find somebody that's also certified as a Medicaid planner. You've got to find somebody in your state because it's state specific. And, one final thing about that. right now, I think that the way that they're handling the pandemic in terms of in terms of nursing homes and long-term care facilities is tragic. I have a problem with the isolation factor. I believe that if you had PPE equipment and you're able to stay 6 feet apart, you should be able to visit your loved ones. And I do believe that it's going to affect what people do in the future. You know, you get to the point, let's say you're taking care of a loved one that's got Alzheimer's, and in the end, it's a 24/7 job, and you get to that point that you absolutely cannot take care of it. I do think that we're going to find some kind of inventive share program where you hook up with other people and you do that, or you find perhaps a smaller facility. I know of some that have only 4 or 5 patients and that's it. And so you kind of got to do your homework and do that. And then the other thing is a possible live-in scenario where you bring somebody in or they split shifts. So there is a community out there trying to help you so that it's not all or one, facility or nothing. But it is time consuming to get there. And my best advice for anyone caring for somebody that has any kind of chronic conditions or who is elderly and aging, that you always want to plan one step ahead. Wherever you are right now in the cycle of care, whether it be your own health care or long-term care, you want to ask yourself, what if? Because it's not a matter of if it's going to happen, but rather when. Typically, we don't get out of this life without having some sort of care needs or transitional needs or even needing healthcare at all. You can have people that are perfectly healthy and wham, it just takes one stroke and they're taken out of the game. And they're still alive, but they're not okay, and they never plan for it. So, yeah, I'm a contingency planner, but I was one of those parents that had the baby bag, the go bag, always packed and ready. I am all into the Boy Scouts and Girl Scouts. You know, have it together, get your stuff together because you're going to need it. So plan for the worst and hope for the best.
Awesome. Well, I don't think we have any other questions.
Okay.
So thank you all for staying. You had some troopers that stayed through the whole time. So we appreciate you guys staying here and all of the fantastic questions. There are several links that I put in the chat that will be here forever. So the doctor visit guide, Bonnie's resources on the advanced directives, the CMB board link, and how to find Bonnie. So thank you so much, Bonnie. I really appreciate your time.
Thank you for having me, and thank you everyone for the privilege of your time. I am honored to be here with you, and I can't wait to see you again. Take care.
Thank you. Bye.